Hey everybody, we're super excited today to introduce
our new nurse, Lindsay.
Hi guys.
Lindsay Sturgeon. So you've been with us how many months now?
Oh, since April, so a few months.
Yeah. We just wanted to introduce everyone and I think just share about all that you bring to the office and to our practice and how excited we are. You want to tell a little bit about your background, what you've done in the past, how you became a nurse, all that?
Yeah, so I was a teacher. So actually, early days, I started as an educator for about 5 years and taught 6th and 7th grade. And then at that time, I decided to do a career change and went back to school and became a nurse. I worked in the ER while I was in nursing school. And then from there, I continued on and had a passion for emergency care. And I was in Anderson at Community. I did that for about a few years. And then from there, I went to Riverview. And I still work at Riverview, PRN, in their ER. But I've been there for about 7 to 8 years. Wow. And then transitioned here.
Yeah.
I think the thing that's exciting is we've known you for a long time. Actually,
yeah. When you were a baby.
I know.
That is pretty crazy.
Your whole life, I guess,
yeah,
really.
Yeah.
And so a niece.
A niece.
Yes.
Yeah, we're so excited.
And you've got a little Jack, and you're married, and so it's kind of fun to watch them come in, and he loves to bring his trucks and.
Oh, he's obsessed with my room. Yeah,
yeah.
He loves it. He loves the chairs.
He goes to our office. Well, and you have been passionate about health and wellness. You might tell a little bit more about your journey. You did competitive bodybuilding in the past even, and so I think we've always had this dream that we would one day be able to work together, and here we are.
Yeah, so I did do competitive bodybuilding for a few years, and I started that in about 2013, and it was very strict regimen on nutrition and just kind of looking at how your body responds to certain foods and certain workouts and certain supplements. And I always shared that with Amy because it was, very different from what I'd ever done in the past. And I was very strict up to like how many grams of protein I had, the grams of fat and carbs, and when I was eating them was very timed. So I did take that all in and can implement it more into like some of my nutritional plans that I can help provide for patients.
Yeah, I think just learning to be your own mini scientist and how your body responds. And I think also like through that, as we've had our own journeys in our life, like with different phases and seasons and like hormone changes. I think you've experienced that too, like when you're doing something so strict, or if your diet changes, how it can positively or negatively impact your hormones. And that's been something I've loved that you've been able to share and educate the patients on so much. Nutrition, hormones, all of that.
Yeah, your passion for nutrition, for all this stuff, I think it excites us because a lot of what we're doing here from a holistic perspective is complex, right? We're trying to understand and look at the whole body, right? The most complex living thing on the planet, and we have really been charged up with your intrigue for how to learn more of this stuff so that you can be kind of also at the forefront of educating our patients, right? For how to implement this stuff in their life. And so I know just a little thought on how can patients be using, or how will they be interacting more with Lindsay, Amy, through your eyes as a provider?
Yeah, I think, it's just been wonderful to have a full-time nurse here. And I think there are multiple ways that we've already seen this interaction, and I think opening and broadening it up even more now that people are aware that you're here and how to use your resources. An extension of me, when I'm in with patients and people are calling in or messaging in, it's so nice because you've got a very broad experience with medicine and emergency medicine and wellness and holistic and all of the stuff we've talked about. And you were a teacher, and we talked about this, how much we both have this passion for patient education and teaching people. So just being a resource to be the frontline person to triage all the messages and the incoming questions, also to follow up on labs. You may be getting a phone call from Lindsay to go in more on, here's your cholesterol's up, here's what we're going to do nutritionally, or your hormones, or whatever we're looking at, or sugar. So we're just going to use you a lot to be helping with some of the education on labs. What am I missing? Medications. Even
She is our
triaging.
IV infusion expert.
That's right. Vitamins and IV infusion. That is true. You have really taken off with, I think, just what you've been able to help grow, and we've been broadening our offerings for people on the IV infusions, which is exciting.
Yeah, and I love that we do the cell well-being and the NutriVal, so we can see where some of those deficiencies are, and then we can supplement with some of that IV infusion, so it goes straight into the blood system,
Yeah.
rather than just like an oral intake.
And it's exactly right.
Yeah, and that's the other thing we've talked about too, because I think now that we are doing more of this, and the cell well-being or the nutrient testing and the gut health testing, that's something that you're getting very comfortable with and familiar with, to be able to also just explain to them what it means, how we can approach getting balance in your body, so that in between my appointments, she's a great resource too, I think, just medically, and to complement your coaching. I think the three of us together really trying to broaden the offerings and the availability for patients in between visits with me.
Right.
It's been
And I think we
awesome.
also want to do this because we wanted to put a face to the voice. If people are calling in, hey, I'm
Yes.
Lindsay, how can I help you? And that's one thing I know from an ER perspective. It's hard to triage sometimes, but not if you're an ER nurse, right? I mean, I've heard you before. You get right in there to try to figure out what's going to be best for the patient, and what's the next steps. What's the hierarchy of urgency for some of the calls that come in. And so you do an excellent job on that, so thank you. But yeah, I mean, here's Lindsay, and this is the face to the voice. You'll be seeing more and more of her, I know, as you start to come in and interact with her even more. It's exciting to have you on board here with us. We're super excited for where we're at, and even where we're going. We just came off of our work retreat and came up with some really exciting things for all of you going forward. It's gonna look out, here it comes. Some neat, really good stuff. When we're looking at effectiveness and efficiency of care for the patients, that's really what a big part of what came out of that.
I think that's true. I mean, that's a big reason, and our push for having someone full-time here to help us with nursing and medical care is to be able to, like you said, triage and make sure that we're getting you taken care of efficiently and safely. And so I think it's just going to broaden your accessibility and longitudinal care for your health. So yeah, we're so thrilled. Great team here. And
I think another thing too is, what's this in between you guys here, honey?
oh, our new book.
Oh my
That's
goodness,
right.
we have a new book out. It's kind of fun. People are calling in. We have
fun.
people coming in
It is
just
fun.
picking them up, which is kind of fun. Hard copy, paperback. We have an ebook. All that on Amazon. You can also go optolive.com/books, or just OptoliV and click the books button. And it'll take you right in there, and you can see how to get these things and some of the shortcuts to get there as well. But super excited to have you.
Yeah.
Lindsay, thank you so much for
excited to
being
be
here
here.
with us on this journey. We will hope to see all of you guys sooner than later. Wishing you a wonderful day. Take care.